Welcome to this video about autism and EBSA. Stresses of the school environment. The great majority of autistic pupils attend school regularly. However, some autistic pupils find the demands of the school environment almost unbearable, leading to emotionally based school avoidance. In a school setting, high levels of stress can be linked with the pupil's differences in understanding social behaviour and the feelings of others, which informs the development of friendships and relationships. Perceiving sensory information, especially noise. Understanding and expressing communication and language, with skills ranging from individuals who are highly articulate to others who may be nonverbal. And a range of other differences, including perception, planning, understanding concepts, generalizing, predicting, managing transitions, passions for interests, and the ability to absorb auditory information. Causes of stress in school for some autistic pupils. The specific causes of stress leading to risks of EBSA will be different for each individual affected pupil. If EBSA is a concern for an autistic pupil, it is important to ask why. Are they struggling to make and keep friends? Experiencing bullying? Struggling to cope with the demands of the school timetable? Finding it hard to tolerate noises, smells, and lighting? Uncomfortable in their school uniform? Striving for perfection in their work and seeing anything less as a failure? Finding daily transitions difficult, like moving classrooms? Not coping well with unstructured time, like breaks and lunchtime? Experiencing difficulty with a particular subject or member of staff? Frustrated with having to complete homework? Getting into trouble with teachers for unintentionally being rude, inappropriate, or not appearing to respect authority? Or finding any sudden changes to their routine difficult? It is important to communicate with the pupil and their parents or carers to understand what the cause or causes of the stress might be. Using visual supports, for example symbols, card sorts, and scaling, can be helpful. Strategies. Finally, after considering what may be causing stress, it is important to work closely with the pupil's parents and carers and teachers to develop strategies and schedules between home and school that support school attendance. This includes adjusting adaptive high-quality teaching strategies and class-based reasonable adjustments to reduce stress, which should be recorded in an updated pupil profile and/or their provision map. It is important in this work to establish if there needs to be changes to the pupil's routines at home when travelling to and from school and within the school day, including clubs. If so, a step-by-step visual timetable with use of colour codes and symbols and a key adult's visual reference should be put in place. Review the pupil's seating plans and map the available peer supports. Consider if new adjustments need to be made, for example to uniform requirements, use of ear defenders, etc. Help them to self-regulate, for example visual stress scales, what-if prompts, and access to calming and self-soothing items. Make available safe and quiet spaces, especially during break times. Consider whether any use of signal cards and passes, for example time out, early leave, and movement breaks, could be helpful. Put in place a system for the pupil to regularly review and communicate how they feel about school, for example using a worry book and having a check-in time to talk with a key adult at the end of the school day. And address any known current issues with peers, including any bullying. Additional types of interventions. Some autistic pupils might also benefit from additional targeted interventions, usually taking place outside of normal lessons, that aim to directly address some of the pupil's stresses about the school environment through planned and evaluated activities. Interventions can be delivered on a one-to-one basis, in pairs, or in small groups. This might include sessions that incorporate the use of social stories, comic strip conversations, goal setting, and cognitive behavioural therapy influenced exercises, including the thoughts, feelings, behaviours, and graded exposure activities. Social skills lessons, including practicing coping skills in anxiety-provoking social situations. This is usually most effective in a small group. mindfulness, relaxation, deep breathing, and visualization sessions, and peer mentoring. In exceptional cases, especially when a pupil is not attending school regularly, it may be appropriate to consider soft landings on entry to school, for example, starting a little later, or going to a specific room or adult before starting lessons, or allowing the parent or carer to accompany their child into school gradually phased out with the use of transitional objects, for example, a blanket, a toy, or a photo. And putting in place a time-limited, personalised timetable with a plan for a phased increase in lesson attendance. This is the end of this video. You can view more videos on this channel in the About series, including other About Autism videos.